When we decide that we want to treat a patient for cancer, we'll bring them to our department. They'll undergo a scan that's called a CT simulation, and we get a nice high-quality scan of the patient. We can, turn around a printed bolus within under 24 hours usually, and we have the ability to redo it multiple times if we need to get what we think is best for the patient as well too.
The radiation beam requires a certain amount of material to build up the dose. If we're trying to treat close to the skin in the patient, the one primary use is something we call bolus. Normal radiation that we use doesn't get full dose to the skin, so you need to put something on the surface to build up the dose, creating areas where we can better shape the dose to where we want to get the dose.
It's given us the ability to provide very personalized and tailored treatment for our patients with the confidence that we know that we're delivering what we think we're delivering, and doing that every day that patients are getting treatment as well. And I think, I just want to emphasize that we're very proud of what we've accomplished here. We are a small radiation oncology facility in central Pennsylvania, but we've been able to kind of adapt a new technology at a pace probably quicker than most places out there, and hopefully we can be an example for other radiation oncology facilities out there as well too.